Good day everyone, I'm Dr. Nico Garcia. So I'll be discussing today about barangay health workers and task analysis. Okay, so let's proceed. So our learning objectives for this lecture is to define what a barangay health worker is, identify their roles in the community, okay, and enumerate the benefits of a barangay health worker. Okay, so a barangay health worker, all right, are frontline workers that support the delivery of primary health care services. All right, under the Republic Act 7883 and the House Bill 10699, they defined the barangay health workers as a person who has undergone training programs under any accredited government and non-government organizations. Okay, and they also defined a barangay health worker who is a person who voluntarily renders primary healthcare services in the community after having been accredited to function as such by the local health board in accordance with the guidelines promulgated by DOH. So how does a BHW gets appointed? Okay, the Department of Health determines the ideal ratio of barangay health workers to the number of household. Okay, according to Republic Act 7883, okay, the total number of barangay health workers nationwide shall not exceed 1% of the total population. However, there is a slight difference in the wording, okay, compared to the House Bill 10699, which is the Magna Carta of BHW. Okay, according to it, the total number of BHWs nationwide shall not be less than 1% of the total population. Okay, so yun lang naman yung difference. Shall not exceed sa Republic Act and shall not be less than for the Magna Carta or dun sa House Bill. Okay, the Magna Carta of the BHW also added that there shall be appointed at least one BHW for every 20 households. Okay, and the BHWs, okay, shall be under the supervision and control of the Department of Health, but they will coordinate closely with the local government health officer in the implementation of the health programs in the locality. Okay, and of course, the BHW, as practicable as possible, okay, must be a resident of the barangay. So to qualify for the registration, the BHW must satisfy 4 things. Okay, one is to the BHW must have rendered basic community healthcare services continuously and satisfactorily for at least 6 months, immediately preceding the date of filing of application for the registration. Okay. Second is the BHW must have completed the basic orientation and training as prescribed by the DOH and conducted by an accredited government agency or DOH recognized academic institution or NGO. Of course, the BHW must be at least 18 years of age at the date of filing of the application and be physically and mentally fit for the job. Okay. In 2015, the BHW Pocket Handbook of DOH listed 5 specific roles of a BHW. Okay. One is to be an advocate. 2, to be an educator. Third is to become a disseminator. Fourth is to be a linker or coordinator. Fifth is to become a record keeper. In 2002, however, the Magna Carta for BHW added a sixth role, okay, which is to become a healthcare service provider. So let's try to discuss them one by one, okay? For BHW to be an advocate, okay, they should be able to support, promote, and champion the current health programs, projects, and activities to improve the access to quality health services towards the improved health status of the community. Okay? The BHWs are expected to know the basic concepts on the priority programs of the Department of Health. For example, maternal, newborn, and child health nutrition program, responsible parenthood and reproductive health program, infant and young child feeding program, garantisadong pangbata program, and they should also be knowledgeable. They're also expected to know regarding communicable and non-communicable diseases, okay, even just the most common ones in the community, and how to advise on healthy lifestyle. As an advocate as well, they should know how to encourage members of their household catchment area, or basically the barangay, to become PhilHealth members. Okay? And lastly, as an advocate, they should know how to encourage active community participation in disease prevention and control. Okay? So next, yung second role of the BHW as an educator. So they should be able to guide and advise the community and on the current Department of Health and the health priorities of the local government unit. Okay? Such as the importance of birth plan and facility-based delivery in reducing maternal and infant deaths, newborn screening for the early detection of congenital metabolic disorders which may lead to mental retardation and even death, okay, among the population. So they're also expected to provide basic information and education campaigns on priority programs of DOH. Like what? Importance of immunization, pre-postnatal visits, or preventive methods. And of course, to minimize or control the spread of infectious diseases like what? TB and dengue within their own barangays. Okay, as disseminator, okay, they should be able to maintain regular communication with local professional health workers on health events and updates and concerns relevant to the community and inform the same community for appropriate action. Okay, for example, may outbreak, okay, or may pressing health concern issue within their own barangay. Okay, so as disseminators, they should act as distributors of information, education, and communication materials like pamphlets and brochures if available, okay, while conducting household education campaigns or counseling. For example, they're going house to house, okay? They should be able to provide IEC materials. Next one, so BHW as a coordinator, so they should be able to facilitate access to any group or association of the community, okay, with relevant network of specific health and non-health service providers. Okay, they should be knowledgeable when to refer clients or patients for their specific needs, okay, of health facilities that provide the specific service needed by the members of their household catchment areas or their barangay. Okay? For example, we need to refer the patient, okay, for physical therapy. They should be knowledgeable on how to refer patients to physical therapists. Okay, for example, patients present with an emergent or urgent concern that the barangay health center cannot accommodate. So they should be knowledgeable what emergency facility they should be referred to. Okay, so the barangay health worker should also serve as a record keeper. So they should be able to maintain updated records of health data, health activities, and events in the community. Okay, other than this, they should be able to regularly update family profile of household catchment areas. Okay, and they should also regularly record important information regarding community compliance of the members of the barangay with the needed medications. For example, if within this household, how many, or within this area, how many are hypertensive, diabetic, and do they comply with their maintenance medications? Okay? Or for example, do they have a lot of pulmonary tuberculosis patients within this area, and are they enrolled, okay, with the TB DOTS program, and are they complying and regularly taking their medications? Okay, so lastly, the BHW as a healthcare service provider, they should be able to assist and provide basic healthcare services as may be needed in the community in any health event. So becoming a BHW is of course not an easy role, no? Most especially if confronted with uncooperative members of the community on the different promotive and preventive aspects of illnesses or diseases. That's why the BHW Pocket Handbook of DOH listed general qualities that any community health volunteer should possess. Okay? So, the DOH mentioned four. Okay? Teachable. The BHW should have an openness to learn new things and to accept feedback or mistakes for further improvement. Second, as a team player, okay, the BHW should be able to cooperate and work harmoniously with other team members. For example, with our community health nurse, barangay nutrition scholar, our community doctor, and even their co-BHWs. Okay? The BHW should also possess, okay, diligence and dedication to the work. He or she should persevere in doing his or her job despite difficulties, setbacks, and the lack of financial support. As we all know, the barangay doesn't have much budget as we want them to have in terms of their healthcare. Okay? So despite this, we want the BHWs to be persevering in doing their job. Okay? And of course, the BHW should be kind, sensitive, and considerate to others. Okay, how about incentives and the benefits of BHWs? Of course, we don't expect the BHWs to do this for free. Okay? So, all BHWs who are actively and regularly performing their duties shall be entitled to a monthly honoraria in the amount of not less than 3,000 pesos. Okay? They're also entitled to the privilege of 20% discount. Okay? With all the items provided under the expanded Senior Citizen Act of 2010. Okay? They're also entitled to hazard allowance in in an amount determined by the local health board of the local government unit, okay, which in no case shall be less than 1,000 pesos per month. And all accredited BHWs who render service within the premise of isolated barangay health stations, okay, are also entitled to subsistence allowance, which in no case shall no less than be 100 pesos per day. So this shall cover their meals, okay, for example, that will be taken during the course of their duty. Other than this, okay, all accredited barangay health workers in the performance of their official duties shall be entitled to transportation allowance of not less than 1,000 pesos per month. Okay? And those who have continuously and satisfactorily served for at least 15 years, okay? At least 15 years are entitled to a one-time retirement cash incentive of not less than 10,000 pesos. Of course, to recognize our barangay healthcare workers, recognition of their loyalty and dedication. So this shall be covered by the municipality or the city on which they serve. Okay, so they're also entitled to training, education, and career enrichment programs. So the DOH, in coordination with the Department of Education, CHED or Commission on Higher Education, TESDA or Technical Education and Skills Development Authority, okay, shall give following programs to the BHW or their beneficiaries. Okay? Educational programs which credit the years of primary healthcare service of the BHW towards a higher education completion. Okay? For example, they want to further train as midwives, okay, as pharmacists or nurses, or even doctors. Okay? They're also entitled to continuing education, study and exposure tours, grants, and field immersions and scholarships. Okay? There's also a scholarship benefit in the form of tuition fees in state colleges, okay, to be granted to one child of every BHW. Okay? And the BHW can also undergo special training programs such as traditional medicine programs, disaster preparedness, okay, and other programs that address the emergent community health problems and issues. And of course, BHWs shall also be entitled to health benefits during their incumbency, like free medical care, like surgery or surgical expenses, medicines, x-rays, and other laboratory fees when confined in a public hospital or health institution. Okay? Other than the medical care, they're also entitled to emergency assistance not exceeding 5,000 pesos. Okay? When incurring expenses in a nearest private hospital in case of extreme emergencies wherein there are no public hospitals available nearby. Okay? And they're also mandatory and immediate members of PhilHealth as indirect contributors. The BHWs are also covered by insurance, okay, by the GSIS or Government Service Insurance System. Okay, so they're entitled to the benefits upon retiring as well. They're also entitled, of course, to seek vacation and maternity leaves. With this, they should continue to receive their monthly honoraria even while on leave. Okay? And they also have a cash gift not less than the minimum monthly honoraria or the 3,000 pesos monthly to be given every December. okay, from the funds of the barangay. And lastly, okay, accredited BHWs who sustains an injury or falls ill in the course of the performance of their duties shall be entitled to 2,000 pesos for every year of service. Okay, so the BHWs can also be eligible for civil service, okay, when they have rendered 3 years of continuous service. And in case of coercion or interference in other civil or criminal cases filed against them while in the performance of their duties, the public attorney's office should provide them with free legal services. And they also have a preferential access to loan facilities. The agencies providing loan services will set aside 1% of their loanable funds for the organized BHW groups. Okay, so those are the benefits and the roles of the BHW in the community. And this lecture was based from the BHW Pocket Handbook, okay, the Magna Carta for BHW, and the Republic Act 7883. So now let's move on to the next part of the lecture, which is the task analysis. Okay, so task analysis involves looking at a person's job and writing down exactly what is done. So we make a detailed description or the steps of what we're going to take in order to accomplish one specific task. It includes skills, attitude, and knowledge needed to perform a task. So here is an example of a task analysis form when we have accomplished our task analysis. So from time to time, we'll get back to this table to take a look at which part of the task analysis we are in. Okay, so task analysis has certain stages. So first thing to do is to select the task for analysis. We then select the sources of information that we're going to use, then collect information from these sources, list the subtask, then decide on the knowledge and attitudes that are needed for the task, and we have to check the analysis table before using our task analysis. So the first step, okay, of selecting the task, in practice, this may take too much time. So it's advisable to just select a few tasks to start with. Okay, it is most sensible to start tasks that are familiar, okay, or are carried out frequently by health workers. Okay, for example, blood pressure monitoring or taking anthropometric measurements. Okay, the next step is to select the sources of information. We can choose one, okay, among this listed, okay, but using several sources is preferred over just one because these sources have their own advantages and disadvantages. Okay, that's why using several different sources is suggested. So we can make use of yourself. Okay, we can make use of manuals, textbooks. We can observe the healthcare workers. We can do discussion with experts like teachers, administrators, and advisors. And we can do discussions with the health workers themselves. Okay, so yourself, you are the most convenient source of information. If you had a lot of experience of a task, you might use that experience as the main source of your information. However, you must remember that you may not have the enough experience or the right experience. For manuals and textbooks, many of our tasks carried out by health workers are described in medical textbooks, teaching manuals and guidelines issued by either the World Health Organization or by the Department of Health. Okay? A task analysis can therefore be prepared and based on one or several of these. However, manuals or textbooks may be intended for trainees at a different level of the health system. Okay? In which case, the skills will be described in too little or too much. For example, our medical textbooks may be inappropriate to use to teach barangay health workers. So that's why the DOH has developed a BHW Pocket Handbook, which will be a more suitable reference for them. Furthermore, they may have been written for different countries or different circumstances that may not necessarily be applicable to our situation. Okay? A textbook will probably give all the background information, but it is unlikely to say exactly what health workers in our country should do. Okay? So the third resource or observation of health workers. In this method, you would choose health workers who are generally regarded by their colleagues or other barangay health workers as being good at their job. Okay? Then, you watch these barangay health workers doing the task to be analyzed. We note down everything they say or they do. Okay? And in the end, we discuss why certain actions were done. Okay? However, in practice, this may take too much time. Okay? But if you have seen 2 or 3 people, okay, for example, 2 or 3 barangay health workers doing the task the same way, then this is enough. This is considered enough. But remember, okay, competent workers will especially be careful. Okay, they will have observership bias to do a good job while you are watching or observing them. On the other hand, workers may generally be competent, okay, but they may not be very good at the particular task you are watching, okay, for that instance only. A further difficulty is that you may not be able to identify all the different stages of the task, okay, because it may happen too quickly before you record them. Okay? Another source of information is the discussion with teachers, administrators, and advisors. When talking to one of these experts, we should not ask them what they would teach. Okay? Instead, we ask them, we do an approach of a role-playing method. In this way, we can piece together the specific actions and decisions, communications that are involved in the task. Okay, but remember that these experts may not realize what the conditions are really like in the field. They may have a good understanding of the overall job of a barangay health worker, but they may not be necessarily good at doing it themselves. Okay, and lastly, a good source of information can be the discussion with the health workers themselves. In this method, like the observation of health workers, we would select a group of workers, okay, who are generally regarded as being good at their job. And then, like the fourth source of information, we would discuss with them a specific task. Okay? This method has the advantage that you will be told what is practical and what is realistic in the field. Okay, you will also hear about other people's experiences in doing the task. But remember that the workers may not be using the best technique because they may have been trained a long time ago, okay, or they may have developed poor habits after the training that they obtained. Okay, so the next stage of performing the task analysis is to collect the information from the sources which you have decided to use. If you have decided to use yourself, okay, or use your own experience, you should note down how you think the task is done. This will be useful in putting your own experience on paper and will help you organize your thoughts. It may also make you realize that there are some details which you may be uncertain about. Okay? You can also consult the manuals and use them to fill in any gaps in your own experience and compare what you think is the correct with the textbook or the manuals. So having discussion, you can discuss any differences between your opinion and what is written in the manual with the experts or the healthcare workers. This will help you decide on what actions are involved in the task. Okay? And you can lastly do observation. You can check your task analysis by watching the good barangay health workers do their job. Okay? Make sure that the sequence of actions you have noted down is the one used by the health workers. You should not include actions which they are not trained to do, for which they do not have the equipment. Okay? So the next step is listing the subtasks. At this stage, you should draw up an organized list of subtasks using the notes you have taken. Okay? The subtasks are the things that happen, the actions, the communications, and the decisions that the healthcare workers or barangay health workers should be doing. Okay? We consider this as the performance objectives for the course. So the subtasks are the skills that the learners should be able to achieve in the end. Okay? And lastly, record these subtasks on the task analysis form in the order in which they occur. Okay, so for example, here is our task analysis form earlier. Okay, so in weighing a baby in a local clinic, there are multiple subtasks to do. Okay, it's not just simply putting the baby on a weighing scale. Okay, so we have to ask the mother to dress the baby in a weighing trousers. So again, this example may not necessarily be applicable here. Okay, so basically we may have to remove those clothing or accessories that may significantly add to the patient's weight. Okay, we have to check and adjust the 0 point on the scale. Okay, and of course, the next step would be placing the baby on the weighing scale and read the scale properly by looking at it straight in front. Okay, and we can follow the succeeding steps. Okay, and what if the mother is concerned? Okay, that's why she had her baby weighed. So the barangay health workers may have to make a comment. Okay, but in order for them to comment, they must be knowledgeable on what is normal. Okay, so go over this example. Okay, so you may have a better understanding of fulfilling a task analysis form. Okay, so the next step is deciding on the knowledge, attitude, and the skills. Okay, so the subtasks are actually the key to successful teaching. However, if students are able to do each subtask successfully, okay, the course is generally regarded as successful. But why do we bother doing a further step? It's because some of the subtasks require knowledge or attitude that must be taught to our healthcare workers. Okay? If the subtasks are the performance objectives of the course, the knowledge and attitudes are the enabling objectives. Okay, so for example, again, look at number 8. Okay, what I told you guys earlier, the subtask here is to decide what comment to make to the mother. Okay, so in order for them to make a comment, okay, they must know which measurement is overweight or underweight or normal. And in order for them to give advice, okay, it involves good knowledge of feeding practices, weaning food, and the food available locally within their area. So in regards to attitude, they must show sympathy for the difficulties that the parents may face. Okay, so now that your task analysis table is complete, okay, we should not use it right then and there. So it still has to be checked. Okay, you must check that what you have written describes what the healthcare workers actually do, especially if you have used yourself, okay, used books or discussions as the sources of your information. The only way to check your task analysis form is to observe healthcare workers doing the task in the field. So we have to see the actual performance of the task. You may find that the best way of doing the task is not realistic because the health worker does not have enough time. They may not have enough resources, or they may not have enough training. Okay, so now we're going to do a short exercise. Okay, so our task here is the steps, or listing down steps in getting a patient's blood pressure. Okay, so in taking a patient's blood pressure, we have listed 13 subtasks for the healthcare worker to perform. Okay, the first one is selecting the correct blood pressure cuff. Okay, so the healthcare worker should have an attitude that is concerned regarding accuracy. Okay, they should have the knowledge that the width of the blood pressure cuff should cover 40% of the upper arm circumference. Okay, and it should cover the length 80% of the upper arm circumference. Next step to do is to make sure that the examining room is quiet. They should be knowledgeable that the importance of a properly ventilated room. Okay, the next step is for the patient to rest for 5 to 10 minutes. So again, the barangay health worker should be concerned of accuracy of his measurement. Okay, the next subtask to perform is the inspection of the arm. So what are we looking for in the arm? The arm should be free of clothing. Okay, if the patient has AV fistulas, okay, if they have lymphedema on that area, then this arm should not be used for taking blood pressure measurement. Okay, the next subtask is to palpate the brachial artery. So they may need to have the knowledge of a little anatomy, okay, on where to locate or palpate for the brachial artery. Okay, they may also need the attitude of gentleness to take care of the patient. while taking the blood pressure. Okay? And of course, they should have the skill of proper palpation of the brachial artery with using the appropriate fingers. Okay? The next subtask is to position the brachial artery at the antecubital crease, okay, at the level of the heart. So again, they may need a little knowledge of the anatomy as well. The next subtask is to center the bladder over the brachial artery. Okay, moving forward, the succeeding subtask is the lower border of the cuff at 2.5 centimeters above the antecubital crease. Okay, followed by determining how high to raise the cuff pressure should be. Okay, and the subsequent deflation of the cuff. Okay, so again, most of these subtasks requires the gentleness attitude. Okay, hindi dapat eager too much, no, to inflate and deflate because we may have the wrong measurement. Okay, and of course, the next subtask is to place the bell of the stethoscope over the brachial artery and inflate the cuff to the level just previously determined on the earlier subtask. The healthcare worker should be knowledgeable as well. Ano ba yung bell? Okay? Ano ba yung diaphragm of the stethoscope? And of course, how to use the stethoscope, how to inflate the BP cuff. Okay? And the last two subtasks, the BHWs should be able to determine the systolic blood pressure and the diastolic blood pressure. So, which among your Korotkov sounds will be your systolic or your diastolic blood pressure? Okay, so next is we have an activity, which is your interview with the BHW. So there will be 4 BHWs that will be available online for interview for about an hour. Okay, so please assign an overall facilitator for the activity so that we can make the interview more organized. Okay, each section will prepare at least 3 required questions with regards to the lecture on the roles of the BHW. Okay, so each section will ask 3 questions. Okay, and after which, if we still have time, anyone from the whole batch can ask their own questions. So please coordinate with each other so that we can avoid the repetition of the questions. Okay, so here are the further instructions for the workshop 7. Okay, for 7A. For the first column, list down all the roles that the barangay health workers will play based on your program plan. Okay, and the second column, what are the tasks that they need to accomplish to be able to fulfill the role. Okay, for 7B, choose one task from the task specified in workshop 7A, then identify the subtask needed to perform the identified task of the community health worker. Okay, identify specific knowledge needed to be able to perform the subtask. Specify what are the must-know knowledge, nice to know, or useful to know. Okay? Identify the attitude needed to be able to perform the subtask. Okay, identify the skills categorized. Whether these are decision making, manual, or communication skill. Okay, so again, the instruction is to identify. So please write the specific skill needed for the subtask. Okay, so the deadline for the submission of the workshop will be on April 9. 5 p.m. And please submit through the Canvas and the UERM email of your preceptor. Okay? So, thank you very much.